Good afternoon, everyone. Thank you for joining us for over the past couple of weeks as we deal with the coronavirus. There have been countless things that have occurred over the past couple of weeks, over the past couple of days. And as if you all have not heard yet, that the governor did put out an executive order yesterday. But along with that, it's important that the governor does not operate just by himself. There is a group team of individuals who help him in the work that he's doing here within the state of Florida. Today, I have a very awesome privilege of having the opportunity to allow the public to hear from one who is on the front lines, who's leading the charge, not just when we deal with coronavirus, but also when we deal with any emergency here within the state of Florida. And he's a very good friend of mine, my best friend, who is the director of the emergency management for the state of Florida. I probably messed up the entire title, Jared, of yours, but bro, I'm proud of you 100%. I see Leah has already jumped in. She's listening in on the conversation. But Jared, thank you so much. And I'm going to give you the floor so you can give us a update on, in your world, of what's happening with the 20+ million people in the state of Florida when it comes to coronavirus.
Representative Jones, thank you. First of all, thank you for allowing a platform where my wife actually gets to see me, so I appreciate that. But are her questions turned off? Because I mean, I'm not answering her texts. So if her questions are turned on, then we're gonna have some problems. So listen. First of all, the Division of Emergency Management is at a level 1. We've been working on this now for over a month on behalf of Floridians and our residents all over the state. Obviously, the situation on the ground continues to evolve from when we first started in late February, early March, where we are now, and where we will continue to go, obviously, as the situation on the ground continues to get worse, and we continue to potentially see somewhat of a surge at our hospitals. I mean, the whole game right now, Representative, is obviously trying to contain the spread. That's why the 30 days to stop the spread was issued by the White House. That's why Governor DeSantis has issued a statewide stay-at-home order for all of our residents. And right now, my focus is, hospital beds, ventilators, the personal protective equipment. Obviously, I'm sure you've seen, I'm using every media outlet possible to try to get that personal protective equipment, ventilators, masks, gloves, gowns, goggles, face shields. And then we're working with the Army Corps of Engineers every day right now, getting our plans approved by the federal government so that we can open up a medical station in the Miami Beach Convention Center, as well as doing hotel to hospital conversions in Dade County. Now, we already pre-positioned a bunch of field hospitals a couple of weeks ago, 2 in Dade County, 1 in Broward, 1 pre-staged in Orlando, and another one pre-staged in Jacksonville. And so we are working on making sure that we have bed capacity. We're talking to all the hospitals about converting their anesthesia machines to ventilators, as well as fulfilling our orders from our vendors that we ordered those ventilators from several weeks ago, and getting a push from the Strategic National Supply of ventilators and personal protective equipment. I'd be remiss to say that if I didn't thank FEMA and HHS, who really have stepped up to the plate for the state of Florida to help deliver a lot of those supplies and equipment that we've asked for, while the private market just continues to have the madness and the disappointment, really. I think there a lot of these large corporations that are going to ask for bailouts at some point in time are really letting the American people down.
Let me ask you, Jared, when it comes to the stay-at-home order that the governor put forth yesterday, a lot of people, they still have questions about it. They're mixed feelings, right? There are some people who say that it's great. Some people say that, there was no difference. It seems like as if people are still out. Can you express the importance of the whole stay-at-home order and why it's important that people follow it?
Yeah, no, look, the U.S. Surgeon General said on television, right, the 30 days to stop the spread is a national stay-at-home order. Governor DeSantis issued that stay-at-home order, and it's a 67-county stay-at-home order with obviously exceptions for essential businesses. And so that is the policy of the state. That had been the policy in the Tri-County area, really 4 counties, including Monroe before then, and in Dade County and in Broward County before then as well. So that's statewide now. mitigation measures do matter. And so, I mean, let me be clear. The most important thing that you can do as an individual is to be responsible. That's all we ask. We ask people just to be responsible. And so, stay home, stay at home with your families, only go out for essential businesses, only go do essential activities. That is what the U.S. Surgeon General has talked about. That's what the 30 days to stop the spread from the federal government is. And that's what Governor DeSantis put out in his safer at home, stay at home executive order.
Churches. So there is this huge, as I look down my timeline, there is a huge battle of different people are interpreting it very differently, and whether or not pastors should have service, they shouldn't have service, although the governor did put it on there that it is an essential service. A lot of people disagree with churches gathering, period, on Sunday. What advice do you give to pastors who are still considering, hey, we're going to go ahead, we're going to have service anyway?
Sure. So, I mean, listen, Chev, I mean, this as somebody who grew up in the church, right? I mean, yeah. I do think religious institutions are an essential business and an essential activity. In these times, I do think people of different faiths should rely on prayer if that's what they feel is necessary. And pastors and priests and rabbis and imams, people of all faiths should go and help serve their congregation. However, having services on Saturday in temples and having services on Sunday in churches is not in the spirit of the 30 days to stop the spread. We still have all our social distancing measures. And so, the no more than 10 people would in those areas would apply. We want people to do social distancing. And so this is not the time to go fill the pews in churches on Sunday. This is not the time to go fill the congregation on Saturday before Passover. But we want people to be able to pray. We want pastors and priests and rabbis and imams to find creative ways to reach out to their congregation, to make prayer available, to make access to prayer available. But obviously, the 30 days to stop the spread specifically addresses that we don't want mass gatherings of any kind.
So we got about 5 minutes left, because I know you have work to do. Period. There was a question that came and said they wanted to know what was the plan for distributing medical supplies and PPEs to community healthcare providers.
Sure. So right now we have stood up all 67 county staging areas in the state. We are constantly running 24-hour missions out of the state SLRC, which is a 200,000 square foot warehouse in Orlando. Our Army National Guard is there helping run that facility. And so we have about 8,500 mission requests in total that have been submitted. We've gone through almost half of those now, trying to fulfill those as much as possible with the supplies that we have on hand. We are obviously prioritizing our folks on the front line, the real heroes in this whole fight. Our nurses, our doctors, our healthcare workers, our physician assistants, our nurse practitioners, the health admin, everybody in community health centers, hospitals, ALFs, nursing homes, that are dealing with around the state. And so that is a constant push. As things come in, they go out. We are not hoarding any supplies. We are trying to get those out in the community as fast as possible. And so the division will continue to run 24-hour operations. I mean, Chev, this is the first time we're actually flying medical supplies on private chartered aircraft, something the division has never done, even in a hurricane. So we're not just doing it by van or by truck. We're a large state, and so every hour counts, and we recognize that.
Jay, let me ask you a question. How, with the last 3 minutes we have, how bad is it out there?
Well, I mean, listen, I'm worried about Dade County. I mean, there's a correlation between large urban centers, people living close together, and international travel, right? That's why New York has the problem. It's why Detroit, Miami, Dallas, New Orleans, Seattle, LA, there's all something that they have in common. So I'm worried about Dade County. I'm worried that we could see a surge. I'm worried about ventilator capacity, bed capacity. We've gone out and purchased 3,000 hospital beds that we currently have on hand. We've signed contracts for over 3,500 ventilators and have asked the federal government to provide thousands others. And so we're working on a logistical plan now to go get anesthesia machines around the state that might be sitting in different surgical centers in other counties where they might not be needed, and surge that into Dade County. And so, listen, right now the situation in some of our other counties looks okay. Obviously, everyone who gets sick, we're worried about them, and everybody who winds up in an ICU needs all the help that they can get. But South Florida continues to be the focus. Miami-Dade, especially so. And listen, we can't mince words. This is a pandemic. It's contagious, and that's why we want everyone to stay inside and stay as safe as possible.
Jay, but I guess the question is I know we've been doing a lot of tests for our seniors, but is there an influx of tests that's coming in for those 18 through 64, or for those who are asymptomatic?
So I think you're going to see an expansion of testing. Florida is actually one of the states leading in the ground of testing. I think only New York and Washington State have done more tests than us. I think after today, actually, only New York will have done more testing than the state of Florida. We really took the bull by the horns in testing. We've looked every single place we can around the world for collection swabs. We've been able to get a lot of those in. There was a lot of focus on testing, test kits early on. We have plenty of test kits. We have plenty of lab capacity. It's the collection swabs, the ability to collect the sample. We opened up a new testing facility in Palm Beach last week. We're going to open up a second location in Palm Beach early next week. We're opening up, there are 2 more locations that have opened up in Miami-Dade, one in Hialeah, one we're going to be opening up in South County by the end of the week. Both myself and the governor have been on the phone with Abbott Laboratories, the ones that run the 5-minute test. I'm happy to say that the state of Florida was included in that. And there are 10 plus hospitals that are receiving thousands of tests per week from Abbott Laboratories to get the rapid test. We've also been on the phone with Cepheid Healthcare. That's another company that has a 45-minute test. They've sent over 8,000 tests to the state of Florida. So we are extremely focused on testing. I know the governor looks at Singapore really as the model for that. And we're trying to make sure that we increase testing, increase it not just obviously among asymptomatic or younger people, but we also want to make sure that we're reaching out to minority areas to make sure that, folks in our minority communities, whether that's in the African-American community, the Cuban community, the Caribbean community, the Haitian community, that they have access to testing as well. And that's something that I'm working on with both Broward and Dade County.
So, and last question, I know the talk of town right now is Broward County and how they're looking at the individuals who are on the cruise ship. And I know a lot of people are concerned. I know that falls under your wheelhouse. Under your wheelhouse also. For those people who are concerned about that, what would you say to those people?
Well, listen, I think Broward County has worked out now. Broward County and the Coast Guard have worked out an agreement with Holland America. I've not seen it. I'm not involved in those discussions. The governor's been very clear on this. Like we want our Floridians back. We want to make sure that our Americans can get to where they need to get to. Obviously, I think a lot of the pressure on Holland America has made them do the right thing. I can tell you the plan that they originally submitted day one was just to let people into the communities which would have overflowed our hospitals. And so I'm glad that we put the pressure on them so that they could do the corporate responsible thing. And I think you're going to see a solution come forward that is going to help folks get off the boat, do the humanitarian thing, which is what we all want, but do it responsibly.
I appreciate it, Jerry. If we want to donate like masks or PPE to medical workers, what should we do? Should we just take it straight to the hospitals?
I would take it straight to the hospitals, get it right to the source. If you want, you can also donate it to the Division of Emergency Management. I'll get it to my Orlando warehouse and get it into our distribution. There are a number of companies that have stepped forward. Disney World, Lowe's, Home Depot have all donated N95 masks to the division. Walgreens has done so as well. So I really appreciate a lot of corporations stepping up and trying to help us in our time of need.
I appreciate it, Jay, man. Hey, listen, again, outside of you being my closest friend, I'm very proud of you and the work that you're doing for us, man.
Appreciate it, Chef. Thank you.
Appreciate it, Jay. Thank you.